My name is Greg Bociek. I grew up in Ottawa, did essentially all of my undergraduate and medical training in Ottawa and other cities in Ontario, and did all of my residency in Ontario and did my bone marrow transplant training here at the University of Nebraska Medical Center. When I was a student, first rotating on the oncology wards in the hospital, I was just amazed at how dynamic the specialty was, how unbelievably interesting it was to give people medicines to see their tumor masses shrink, to see them feel better, to see them get up and get out of bed. And it just struck me that there was a great deal of personal satisfaction in seeing people get better, as well as the science of seeing tumors shrink and learning that cancer is a genetic disease and a disease of disordered genes in people. And I knew that if we could get smarter about figuring out what the genetic abnormalities were in these people, we would get smarter than just using plain old chemotherapy for the next 25 or 30 years. And it turns out that we have. I spend most of my free time with my family, and we're either out camping with our dogs somewhere, or I'm in the basement writing, recording music. I used to be a professional musician, and that's still a big passion of mine. And I actually put a CD together every couple of years and try to let people know something else about what I do when I'm not a doctor. I always found as a kid that I had just an interest in biology, always interested in how bodies worked, how people work, how organisms worked. My father was a radiologist and my mother was a nurse, and there was a fair amount of discussion about medical topics in our house, and I just always found an innate desire to understand people, bodies, what make things work, and I guess I always edged more towards science than other disciplines that other people find intriguing. The reason I like academics so much is because we live in a world of such a hugely increasing amount of data that it becomes very difficult, I think, for doctors to know how to be experts for, say, 12 or 15 diseases. So being in academics allows me to concentrate on one area, allows me to feel like I can know that area better, and allows me to feel like I can provide the best possible patient care. The thing I find the most interesting when I first sit down with a patient is to get a sense of their anxiety. They're obviously in a new place that's very different. They often come with family members. My first few minutes, although I'm talking to the patient, is spent kind of assessing the room and trying to get the temperature of everyone and feel what the anxiety is, who's worried. And I try to take that anxiety out of the room as much as possible by just making a couple of initial statements that will help them understand they're not in such a scary place, and maybe they don't have such a scary illness as they were first led to believe.